had a mix in the room when we're teaching a certification. We've always had a mix of brand new, newly certified personal trainers, or even thinking about getting certified, in the process of getting certified, right? Like we even have fitness enthusiasts in the room sometimes that actually don't even like work full-time in fitness. And then on the other side, we've got the veteran trainer, we've got the clinician that actually loves to work out. We've got like some really smart and experienced people who also show up to be a part of the certification. And for me, one of the things that I noticed when I started teaching was those two seemingly very different groups of people actually got along really well, worked together, supported each other. Like the people that were new had a ton of enthusiasm and energy, and kind of reminded some of the veterans, like, yeah, we do have like the best job ever. And then the veterans were kind of showing some of these new trainers, like, this is actually a viable career. You can do this, you can make a living at it, you can make an impact. There's lots of ways to go, right? So talk to me a little bit about like how you think those two kind of main populations are so important to what we're trying to do as a PPSC team in the fitness industry.
Man, it's the full spectrum. It's the full spectrum. I know coming off of COVID, where we did our first event back in Orlando, Florida, with all of our instructors there, we had a packed room. And I knew after COVID that we had something special after that first course back, because we had a chiropractor there. We had multiple physical therapists. We had a physician in the room. We had brand new trainers, and we had trainers that have been involved in professional sports across the country. And in that room, we had rave reviews on the system because it was applicable and it was something that people were looking for, which are results. And that's something that makes me proud because it's information that is able to scale and transcend populations. Like, of course, people are coming in and we're trying to better train around pain, eradicate pain, or manage the presence of pain in a training scenario. But the thing that humanizes the PPSC, whether you're a physician or whether you're thinking about getting a personal training certification, is that we know that what we've been doing is most likely not the most efficient or effective way forward in terms of health, longevity, or you training as smart as you possibly can that day, because there's a lot of unknowns out there. And I think if we're all honest with ourselves, there's a lot that we don't know. And there's a lot of pieces to the puzzle that we don't necessarily know how to put together quite yet. You know, at the PPSC, we're not ones that are going to be like, hey, I invented the wheel, now we can ride. That's not us. We are trying to take the things that we know to be good, true, and effective and simply have them be able to be utilized in a training scenario. And I don't care who you are, what kind of information or education that you've had in your previous past, it's something that brings everyone together, because instantaneously feeling better in the way that you're moving, being able to reestablish a movement pattern to move like a human again, and be able to feel, tangibly feel a difference instantly on some of the things that we're doing, that brings everyone together. But feeling a difference in an industry that is so centered on long-term benefits, that instant gratification of being able to, oh, whoa, I've never squatted like that before. My hips didn't pinch. My shoulder doesn't feel like shit when I go up overhead right now. Those are things that can compound over time to really make a marked difference in anyone's movement arsenal.